And also another is one is the craniectomy and cranioplasty. So what is craniectomy and cranioplasty? That craniectomy means a removal of the flap, and also that's a skull is going to be, we are going to, if you remove this complete like a window, so this is going to be, after that, we are going to keep into the, like in a specialized or in the safe area, maybe with the, on the patient body, or maybe in the refrigerator less than 70 degrees of centigrade, minus 70. So craniectomy means is the removal of the bone, commonly an emergency situations. So this is not immediately replaced. So because of in case of severe swelling, so they are going to replace after the 2 to 3 months, they're going to replace it. The cranioplasty means again, whatever the remove the bone part is going to replace again into the normal positions. So the technique is called as cranioplasty. So here in the cranioplasty, so usually carried after the 6 to 8 weeks. That means after the 2 months are going to do this after the decompressive craniotomy. Assuming that the patient has recovered from the initial injury and also hydrocephalus and brain swelling is not present. So after the brain swelling, after the subsiding the swelling, after the like a hydrocephalus or if the brain swelling is going to replace into the same place, that is called as the cranioplasty. So in the interim, there is a hockey helmet. How they are going to fix it in the like a fix it. Same, they are going to be like a helmet is going to be fixed after the surgical procedure. So autologous, the bone flaps are maybe the frozen after the initial surgery, kept in the abdominal subcutaneous tissue. So this skull is going to keep in the patient abdominal subcutaneous tissue, or maybe they're going to keep it in the freezer, so at the minus 70 degrees centigrade. So why they're going to keep these things in the patient subcutaneous, abdominal subcutaneous tissue means, so to prevent any complications here, because of the infections are going to be, may chance to get the less, and also if you keep it outside, may chance to expose to the pathogens, and also may chance to get the infections. And also autoclaving of the bone, that is if contaminated by a compound scalp wound. So if in case of any contaminations, so they're going to do the autoclaving of the bone, so before going to the surgery. So after sanitization, autoclaving, so they're going to fix it. So and also fix it to the normal where they're having the injury site. So these are may chance to get the complication associated with the abdominal preservations of the bone flap. So the bone reabsorption is going to be 5 to 10% because of due to hypovascular bone necrosis and sepsis. May infections or maybe the vascular necrosis, bone necrosis may chance to give the complications. So in these conditions, the other materials, the methyl methacrylate and also titanium mesh, when the bone is heavily comminuted and also contaminated. In if any contaminations, they are going to use some mesh, titanium mesh are going to apply. So these are going to put into the mesh along with this contaminated flap is going to replace. So after replace, if you see here, so this is the before the treatment, and after the treatment is going to be same like a normal, the normal skull. So there is no depression, there is no shallow appearance. So that is the main mechanism. So this mechanism is called as the cranioplasty. So that means they're going to fix it in the same place. So that is about the surgical procedures. The removing of the skull is going to call as the craniectomy. After replacing the bone flap into the same place, so that is called as the cranioplasty. So this is about the treatment plan, about the medical management, and also surgical management of the traumatic brain injury.